Hi, I'm Marie Hopkinson. Welcome back to the Chinese Medicine Podcast. This is the place where you can come to learn about Chinese medicine, learn about your body in a Chinese medicine way, and have your questions and your diagnosis of Chinese medicine easily and simply explained to you. So that's what I'm going to attempt to do today. I've got a question from a subscriber. His name is Eckhart Tolle. That's his YouTube name. And he says, I'm so confused and unable to figure out my diagnosis. Could you please help me out? So we're going to answer his questions and look at his symptoms and have a look at what could those things mean from a Chinese medicine perspective. So before we get started with any further stuff, I just want to let people know that this channel is not a replacement for medicine. So that's one thing to remember, right? I love explaining Chinese medicine and I love talking about it. And I am a real Chinese medicine practitioner. I'm a practitioner in Australia. So I do herbs and acupuncture, and I'm also a teacher of Chinese medicine. So I've got lots of experience at explaining Chinese medicine. That's why I love doing this channel. But it's also really important to know that there's some things where a YouTube video isn't going to be enough to fix your symptoms or to address those things. So what this channel is for is to explain and help you and empower you so that you can use, you know when you might be able to, you know when it would be good to go and see a practitioner, and you know the things that you could maybe do to help yourself and improve in a self-help kind of way. But that still isn't a replacement for medicine or a replacement for the need to go and see your acupuncturist or your Chinese herbalist. So if you're watching this video and you're thinking, yeah, I'd like to see a herbalist or I'd like to see an acupuncturist, but I'm not under the care of one, then you can send me an email. My email, I'll put a link in the description box below, and you can send me an email and say, hey Marie, you need to tell me your suburb, and please don't put this in the description at the bottom because keep your privacy online is a good thing to do, especially on YouTube. So don't put your address in the description below, but just send me an email and say, hey Marie, I was watching your videos and I was wondering if you could see if there's any practitioners that you know near me, because I know lots and lots of practitioners all over the world that do the same system of Chinese herbs that I do. So it's a very specific pulse-based Chinese herbal system. Plus I'm also part of a network of lots of different practitioners through some Facebook groups and things like that, and I can always put the word out there to see if there's someone that you can find. Now there's also Google, and you can do your own research to find a practitioner. So I guess what I'm saying is this is not a replacement for going and seeing a practitioner. So now that we've got that kind of stuff out of the way, then let's get into the video. So we're going to talk about this guy's question, and he says, my symptoms are tinnitus, floaters in the eyes, dry eyes in the morning, a prickling pain on blinking, swollen and scalloped tongue coating is thin, white and wet, a bitter taste in the mouth in the morning. I cannot digest grains and legumes. It causes joint cracking if I eat them, especially white rice. Grains and legumes cause bloating too. The only physical anxiety manifestation, like a tight chest, shoulders and neck, brain fog, reduces in the morning on days I don't eat dinner, and low motivation, life feels blah. I think this is liver and spleen related. That's what he's saying. I need your help. I'm so tired trying to fix it. So we're going to help you understand what this could be in Chinese medicine and where different aspects of Chinese medicine could help you. So let's start with the first couple of symptoms, and we'll sort of group those things together for you. So look, there's lots of things that Chinese medicine practitioners would treat or tackle or look at. And the Chinese medicine system is a system that was developed firstly before you had, in China, you didn't have the advancement of Western medicine to the point of where it is today. And so there's lots of things that Chinese medicine knows how to treat or how to understand those things. But in a modern day approach now, we understand them differently in a Western medicine context. Now, where does Chinese medicine and Western medicine kind of come into these things? So maybe I'll make another video just on that, because that sounds like another topic. And if you're regular on this channel, you know I tend to get off on tangents and whatnot. So we'll stick to this guy's thing, but I just want you to understand that this is all within a Chinese medicine context. So when he says liver and spleen, it's the functional systems of those elements, of those organs that are associated with those elements, where the problem is. It's not so much like, okay, liver as in his Western medicine, his actual liver. It's the functional aspects of wood that kind of does that thing, that has that problem. So floaters in the eyes and dryness in the eyes, that relates to your liver. And in specifically liver blood deficiency, or the lack of wood to kind of be nourished by the blood. So the blood aspect is the nourishing of wood, the yin of the wood, if you like. And so if there's lack of nourishment, like, then it makes sense that the eyes get dry, because that's a yin aspect. It's the nourishment of the fluids of wood. So the eyes relate to wood in TCM. And so any kind of dryness really relates to a lack of blood to nourish and moisten that area. And particularly in TCM, they differentiate this as liver yin deficiency or liver yin aspect, but it's still yin and blood are very similar in that moistening effect. So we can just think of it like that. There's a lack of moisture. So why is there a lack of moisture? Well, you might have blood deficiency, and that's how a Chinese medicine practitioner would think. So if you came in and you said, I've got dry eyes, Marie, and I've got itchy eyes or very sore eyes, because there's a lack, sort of Chinese medicine practitioner would think, okay, there was a lack of moisture there, and that's not, and then your body's not able to nourish its eyes properly. So why is that happening? Why isn't your body producing the moisture it needs? So we would check your pulse, and that would really tell us the main reason. Now, the system I practice of Chinese herbs, we don't really look at your tongue that much, even though this guy's sort of given me his tongue diagnosis here. So I can talk a little bit about that, and I'll give you a bit of information about why, and why that's different, or why in different systems they use different things. But also, that's where the beauty of seeing a TCM or a Chinese medicine practitioner comes into it, because you can't check your own pulse. Unfortunately, there's not a system yet to teach you. I can't teach you through YouTube in one video how to do that. Even 10 videos. Okay, so he has floaters in the eyes and dryness in the morning, and then prickling pain or blinking. So the pain is probably due to the dryness, right? There's not enough moisture kind of going in there. And then he says he's got a swollen and scalloped tongue and a thin tongue. His tongue coating is thin, white, and wet. Now, what does this mean? So when this is in a TCM sense, this relates to spleen, what we call spleen qi deficiency. Now, there's lots of videos I've made on this, and you can check those out on this channel to kind of understand that. And there's also a video called "What Does My Tongue's Got a White Coating, What Does That Mean?" Something like that. So your tongue itself, the body of your tongue represents your organs in the body of your organs, let's say. And the coating of your tongue represents the fu organs, or the digestive organs, or what we would call the dirty dregs of digestions, kind of reflected up on the tongue. So the tongue coating changes a lot, okay? It can change day to day. So if you go to an all-you-can-eat buffet and you eat a lot of foods at that buffet, and you get like what we call food stagnation, then you will probably have a really thick, greasy tongue. If you've ever gone for a night out and you've had a lot of big foods, and a lot of eating and drinking, especially alcohol and things like that, and your tongue coating might get really thick and greasy, like you even feel a furriness in your mouth. So that's the dirty dregs of digestion. And then if you're a healthy person, that could just go away. If you're not a healthy person, that might linger on, or if you continue on with that diet. So your tongue coating is really influenced by your diet, what you eat. And that if it gets really yellowy kind of colored, then that means there's not just dampness or congestion there, but that's transforming into heat, and your body's kind of got this heat, and it's kind of blocked and trapped, and now it's coming up onto your tongue. Now, so the body of your tongue is a different story. It takes a long time to change, and so that the body of your tongue can show things that were going on in the past. It can show things that have since been resolved, or things that are not like necessarily the focus of the treatment. Now, it might be part of the whole overall picture of things, but so it's a little bit different to your pulse. Now, this is one of the things where Chinese medicine practitioners kind of struggle with when they're first learning. Students of Chinese medicine struggle with this, because they're like, well, Marie, the pulse says this, or the pulse is showing the person's deficient, but their tongue's so thick and yellowy coloured, and it's it's showing something else, or it's red and peeled or something like that, or whatever. It's just showing something different to the pulse. So what do you do? Like, what do you treat? So this is where different styles of Chinese medicine will say different things, right? So the stock standard, pretty common style of TCM is kind of like almost like an evidence collecting, kind of collecting all of this stuff, but they don't really have like a hierarchy of evidence necessarily, like, or this thing is more important than others. And even somewhat I was taught sometimes in my early days of learning Chinese medicine, or I know this was bantied around a lot, because because people don't know how to check the pulse properly, or maybe you graduate from Chinese medicine school, you don't know how to do it very well, you don't feel confident in it, so you don't consider that evidence as highly weighted, you don't think of it as meaning as much, and so you think, oh well, I'll rely on the tongue more because I can see it, and I can actually, it's less subjective, it's more objective. It means like two people could see the same tongue and probably come up with the same thing, whereas two people could check the pulse, depending on their experience, they might not necessarily get the same thing. And this is one of the reasons why I went and did the style of study that I've done now. And this style of classical Chinese medicine relies more on the pulse. But the only way it can do that is if you constantly train in it and you constantly like try to get better at it by training with your teacher or your teacher's teacher or stuff like that. Like you can't just get better at it by reading books on it. Like you have to constantly practice in it, practice doing it. And be like brought back to that same place of like, we'll basically be corrected. If you're wrong, you have to be open to being corrected in it. And that's how Chinese medicine is supposed to be practiced when or supposed to be learned in that system where you would sit with your teacher for days and days and months and years until they thought you were good enough to kind of go out on your own, and you would always have that training of your teacher, your master or whatever. Now, they just don't teach it like that in schools anymore. You have 4 years of study and off you go, you're out in the world. And that's what I did when I first studied. Anyway, I promised this video would be to answer this question, not give you a rant about Chinese medicine, the failings of the teaching system of Chinese medicine in the West. But anyway, so what is he saying? He's got this scalloped tongue coating. Now we don't know what his pulse is, so that's why I'm saying like it's impossible for me to give people a Chinese medicine diagnosis without checking their pulse. It's just how it is. However, like these symptoms do mean something, and they are important, and we don't just use the pulse. We don't just go, okay, well it's all the pulse, and we have to know some symptoms as well. But the pulse kind of guides us in what's important to treat first, rather than like getting confused with all these things. So what can happen is you can have a mishmash of all different kinds of symptoms, and you can have your body can have 2 or 3, in Chinese medicine called patterns of disharmony, or 2 or 3 diagnoses going on, imbalances happening. Which one do you treat first? Which one do you tackle first? Or do you just tackle them all at the same time? The pulses kind of guide the practitioner what to do in that order. So let's talk about this. He says he's got the swollen and scalloped tongue. So what happens when the tongue grows, when the body of the tongue grows too big? That's showing that your spleen can't transform fluids properly. And that's why you get the tooth marks on the side. So I'll put a photo up here of a standard kind of tooth marky looking tongue. So what's happening is the tongue itself is growing bigger and the person's biting down on the sides of the tongue. And so that's showing like a fluid metabolism imbalance. Like the person can't metabolize, or they're having difficulty doing that. Now, they could have things like fluid metabolism problems, like as in they could have puffiness in their body, they could have like edema, that's fluid retention. They could have difficulty with urinating, so they might not be urinating enough and the fluid's going into their body, or they might be weeing a lot all the time. And so there are other symptoms the practitioner would ask them to kind of work out what's going on there. Yeah, and so that tongue is kind of showing a spleen qi deficiency or earth element, unable to transform water, and then there's some dampness accumulating because of that. So because it can't transform water, well the water that's left over isn't transformed properly, and that creates that dirty dregs, which is the thick or the coating on the tongue. Then he says, I've also got a bitter taste in the mouth in the morning. So that's a gallbladder or a wood-related symptom. So your gallbladder and your liver are 2 paired organs, and they look after the aspects of wood in your body. So we already said the liver kind of relates to blood, which is the yin, the nourishing yin aspect of the wood. But you also have the movement of wood. And so when you get a bitter taste, it's kind of reflecting a bit of like probably stagnation of wood leading to a little bit of heat, and that heat's causing that bitter taste. That's how TCM would kind of think of that issue. And then he says, I cannot digest grains and legumes. It causes joint cracking if I eat them, especially white rice. So there's a couple of things with grains that it depends on, like, so, okay, grains and legumes cause bloating as well. He says, I cannot digest grains and legumes and grains and legumes. So legumes are definitely much harder to digest than grains. And I have done a couple of videos on grains and dampness. Now, usually, not always, white rice is the most easy to digest of all the grains, and it should cause people less detriment. But if you're even having trouble with white rice, it might mean that your spleen's so depleted that it's having difficulty kind of digesting even that. So it might show that your spleen's like really depleted. So I'd be interested to see what your bowels are like, and that would tell us how depleted your spleen energy is. So if your bowels are really, if you've got really loose bowels, like diarrhea, not properly formed, very loose, or if it's even worse, you might have, so that would be spleen qi deficiency. If you're spleen yang deficiency, then it's more like undigested food, or the diarrhea is a lot, like it's very frequent in the day, or you first thing in the morning you got to wake up and run to the toilet to have diarrhea. So that's one issue. You could have constipation in this scenario as well, but that would just mean something else. So if the water aspect of your body is kind of overwhelming and the spleen, the earth can't digest that water, then it accumulates, and that's what happens, and the earth can't hold the yang of your body, and it just kind of comes out, and so that's where you don't have the yang to properly form the bowels, and then they get loose and you get diarrhea. So that may be happening, or that may be part of it. But his thing about the grains, so this is where the paleo diet kind of makes sense in a Chinese medicine way, because they don't have grains. And it's like, well, if your body it's actually easier. The easiest things that it can digest are like properly cooked and properly moistened meats, and small amounts of that with vegetables. So like a wide variety of vegetables. And so if you can't eat grains, I would say try to eat more things like pumpkin and sweet potato, and turnip, parsnip, beetroot, that kind of stuff, because those vegetables are, like, obviously they're carbohydrate vegetables, carrots, and they're nourishing to your spleen, to your earth element. They shouldn't have the harsher difficulty to digest, and in addition to that, definitely stay away from processed. So try to go onto a diet where you go away from all processed stuff for a while and see how you feel. And so the good thing with Chinese medicine is if you can strengthen your spleen and earth enough, particularly warm up your intestines again, so that often what happens is as you get more and more deficient, more yang deficient, your body gets more cold in your intestines area, and then that means your gut health is not so great and you just have those food intolerances. But in Chinese medicine, we think if you can strengthen your digestive system again, then you may be able to digest those foods without any problems later on. So that's a good thing to remember. But in the meantime, it's good to just kind of not overwhelm it, and not have not place too much too much strain on your digestive system. And I've had a couple of patients over the years that couldn't eat rice. It's not a common thing, but I have seen it before, and I've seen some patients where they've had like a manifestation of symptoms of dampness when they eat rice. Like they have had numbness on their spleen channel, which is the inside of their leg or something like that, and that's very unusual, but it can happen. Okay, so he also says only physical anxiety manifestation like tightness of the chest, shoulders and neck, brain fog. So these are really interesting symptoms. So one is that so this guy's got this imbalance between wood and earth, right? So what's happening is if the earth gets weak and it can't support itself, then the wood element easily invades it. So you have this thing, this cycle called wood, fire, earth, metal, and water. And what happens is the wood, I'm going to put this up on the screen, so one of them's probably going to be right on my face here. And so what happens is that the wood can get what I call like too big for its boots. It's like having a brother and a sister in the back of the car, right? Or two brothers or something like that. I grew up with two brothers and a sister, right? And so there was always a fight in the back of the car for who was in the right spot, right? And I often use this example with my students. It's like, I don't know if you've ever had a family and like you're in your seat and the brother's like, no, don't get onto my side, and the other one's like, no, don't get onto my side, and they're kind of like pressing the crack of the seat to try to make sure you don't encroach on the other areas, right? And my two brothers would always say things like, no, I need my bowel space, and like spread their legs out, right? And then say, no, you don't understand, like I need to spread out. now that's called mansplaining. But yeah, I grew up with a family like that, and so there was always like this little fight in the back of the car. Now whoever's the strongest one is the one who wins, right? So if the weakest kid who like doesn't who puts up with the fighting kind of gives in eventually and just goes, oh whatever, and then let the person take up their space, right? And so it was a good exercise in like, I don't know, assertiveness, I guess, as a young kid, because you're kind of always fighting for your space. You're like, no, don't get in my space, and they're like, no, your leg's poking under my space. Anyway, so the reason why I'm saying that is because sometimes it's a little bit like that with the wood and the earth, right? And so whichever's the weakest one kind of gives up, and the wood kind of punches its energy onto the earth and sort of, no, like let me in, and it's because the wood energy in our body is a growth energy, so it needs that. It's got that movement, it's got that spreading. We need that, and that's, if you don't have enough of that, you don't have things like motivation. You don't have things like your wood element is like life planning. It's doing new things. It's that spark to kind of get your creativity going, and even people who are very highly creative go through periods where they like blah, like I don't really feel like doing anything. I don't feel motivated. And then other times you can just be like, wow, I just feel like it. Why do we just suddenly feel like it? I just feel like I can do everything. I can do what I want to do. And also just knowing what you want to do, having that plan and that purpose and a life direction is a very wood element aspect thing. Anyway, so the reason why I'm saying that is because what can happen is the wood gets too much. Like, so that wood element that wants to move and expand, it's meant to, like, there's a cycle in Chinese medicine called the controlling cycle. So the wood is meant to control earth, right? And what we mean by control is not like be mean to it and sort of victimize it, but help it, but kind of like a parent kind of looking after a child. You control them in a loving way, because you want them to grow and you want them to not get hurt, and you want them to kind of so it's that kind of relationship, right? So you don't want them to put their fingers in the power socket, right? Because they might electrocute themselves. So you kind of got to like give them instruction and teach them, right? What they're meant to be doing. So it's kind of like a little bit like that. And the reason why I mentioned that brother sister thing is because it's sometimes like that. And so that if the earth gets weak, it just gives up and it just goes, right, well, you can bully, almost the wood becomes a bully to the earth, and it kind of overpowers it. And that's sometimes where you'll get these, let's see, what was that symptom we're talking about? The anxiety and the tightness of the chest, the shoulders and the neck. So what's happening there? The shoulders area, it relates to your gallbladder channel, which is the chi of wood, the movement of wood. And so if you've got tightness kind of across here, up to your neck, the back of your neck, just here, over to your shoulder, across here, that's all a wood element aspect. Then the other thing that can happen is your diaphragm can get tight, and that tightness kind of pushes up, and then you get sighing like that, right? So I'm really exaggerating that so we can kind of see, but that's essentially what happens. So I've got another video on how to treat liver chi stagnation, and that's kind of those things like singing, laughing, and exercise are the three things you can do to kind of help that wood element, to help move it along, keep it moving, and keep it flowing smoothly. And that's a really great thing to kind of do. But what's happening, I think, in this guy's situation, or what could be happening, is that at some points the wood is too strong and the wood is moving too much, and it's kind of pushing that, like it's causing this stagnation and this tightness. But then it seems like because that wood is also deficient, right? Because we know he's got the dryness, he's got the dry eyes and the like those liver blood deficiency things. And this is where we wouldn't know unless we check the pulse. So on the pulse, be very clear if there was like an excess of wood or if there was a deficiency of wood. That'd be like a no-brainer to kind of like, you'd instantly know that. So that's, if I was doing a consult with someone, and the reason why I make these videos is so people can understand how Chinese medicine works. So it's not sort of mystical woo-woo, it's like got a really systematic kind of approach to how it works. And that's what we would do. We would ask those symptoms, we'd kind of know that, and then after checking the pulse, like in my system, we check the pulse much earlier than a lot of other TCM practitioners, like maybe after a couple of questions and a little bit of a chat, maybe 5 minutes, I'll be checking the pulse. And then I'll ask some other questions kind of after that as well. But anyway, so what we would do is, because we would, if he did have that deficiency of wood, that would tell us that, well, if wood's deficient, it's not able to move. It's not able to give you motivation. It's not able to give you the ability of life planning. So, and that's why his other symptom, he says, I just feel blah. Life feels blah. I have no low motivation to do anything. And so the anxiety symptom relates more to the earth, and the motivation symptom relates more to the wood. So the earth is the spleen and the stomach, in this case more the spleen. So worry and pensiveness or overthinking is a symptom that relates to the spleen, and that can also relate to the kidney or the water element if there's fear involved. So if the person's very fearful in their worry and their anxiety, and they just that's a sort of a difference between someone just worrying, like a lot of circular thinking is a different kind of also worry. So there can be a little bit of both of those things involved there. So there could be some water or kidney functional things going on there. So again, these are not it's not your Western medicine kidney. You don't have kidney disease or like a liver disease. These are functional aspects. That's why I'm referring back to the 5 elements, so you can kind of understand that in a little bit better way. Then the brain fog. Now this is a great symptom to think about with dampness and spleen qi deficiency, because brain fog, it's a specific symptom of like this cloudy headedness. So you feel like as if there's sometimes people feel like as if there's a tight band around their head, like pressure around there, or just like they are literally walking around in a cloud. And this is something I see a lot with acupuncture. Once people have a treatment, that can often lift off their brain. Like they come in feeling foggy headed, and after a treatment they feel like, wow, I feel so clear. Now that can last a couple of days, that could last a week or so after the treatment. And this is where other aspects of things can kind of come into it. So herbs may be able to help that, but I don't think they help it as quickly as acupuncture can. It's something where acupuncture really seems to be a very quick acting in that way. Like if sometimes brain fog they could have no sinus symptoms or no sort of actual like phlegm, post-nasal drip, that kind of stuff. But if they do have that, then that can be contributing to that that phlegmy, damp kind of aspect of things as well. So yeah, that brain fog thing is a symptom of dampness. So often with damp, people have heaviness. So their body feels heavy, their limbs feel heavy, they feel weighted down. With qi stagnation, they feel the sighing, they feel like the tightness here, they feel this, tightness or pain in the thing there. If it gets even more stuck and blocked, then sometimes you can have headaches and things like that. Now, the final symptom, which was his first one, is the tinnitus. And this is probably a bit more complicated because there could be a lot of things that this could mean. So one thing to think of with tinnitus is, so what is tinnitus for a start? Some people don't know what that is. So it's a ringing in the ears or a sound in the ears, or sometimes accompanied by deafness. So it's where a sound is, because you can hear a sound, so it could be something like a shh sort of sound, like the TV tuning in kind of sound, or you're tuning in an old radio and you can kind of hear this shh kind of sound. But it can be a pinging sound, like an actual tone, ooh, 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 that kind of sound, like a low pitched sound, or an actual booping, boop sort of sound. It could be like a cicada chirping sound. That's a common one as well. And so it doesn't really matter what the sound is, just in general, because there's a sound there that's taking up like a little bandwidth of the sounds that you can hear, and that can give people deafness, as in it can give them a difficulty, a disability in hearing, or a difficulty in hearing, because let's say that you've got this much range of sound and there's always this bandwidth of sound being taken up because there's woo, or this ch, or this tss, or tss, or whatever the sound is. Or the cicada chirping sound, then that means that they can have difficulty in hearing everything or hearing accurately. Now, tinnitus can come on like randomly, like you can be doing something and you just suddenly woo, and then it goes away. and then can kind of come on, come off again. Or you can have just a constant noise in the background. And also tinnitus can be caused by, in a physical sense, damage to your ears. Like you could have like an actual, like I'm a muso and I play with a lot of musos, and they almost all of the people I play with have tinnitus. Complain that, like, you know, a lot of musos I play with have tinnitus because they're around loud noises all the time. And that's not just, it's just bad form to like not look after your ears, to play loudly all the time, and not use earplugs or not protect your ears, right? So there's some professions where people just don't protect their ears, or they might have just been exposed to loud sounds over and over and over. So that's something to remember if you are a person just watching this. Like, be careful. You only have one set of ears, so be aware that that, you know, that's a good thing to do. Now, this guy said he's already got tinnitus. So also in Chinese medicine, colds and flus could be something that precedes getting tinnitus. And so in a Chinese medicine sense, what causes tinnitus? Well, it's not an easy one size fits all. Like, there's different kinds of tinnitus and different things that cause it. But in the classical Chinese medicine sense, we think tinnitus is like an upward rushing of yang. So weak yang floating up towards the head and causing this thing. So if you have strong yang, it kind of is consolidated and it will just stay where it's meant to stay. If you have weak yang, it kind of floats up, and it's a very similar situation to getting a headache or a migraine. In a Chinese medicine sense, the functional reason for that, for getting tinnitus, is the same reason you get a headache. And this is where, like, if you're watching this and you're a Western medicine person, you might think, well, Marie, that's completely nonsense. That's just woo-woo and mystical. It's just a different way of thinking about how a body works. And so there are completely different herbs that we would use, but it's the same idea of, like, if we're checking the person's pulse and we're looking at, is this person deficient? Is this person excess? Let's say from a very basic perspective. And where best does this tinnitus symptom kind of fit in those patterns? And the pulse will kind of guide us. And this is where in Chinese medicine, if we treat you functionally, then we are treating your body, not the symptoms. So it's not like, oh, here's 5 herbs that are good for tinnitus, or here's 5 herbs that are good for headache, and we're going to go and kind of use some of those. It's more about knowing the dysfunction that's happened in that person's body. Why can't they support their normal function? That's what should be happening. They should be able to just support their normal function. They shouldn't be getting headaches or tinnitus or whatever's going on. And so we want to support their body's normal function, restore the homeostasis that's happening in their body. And so that's the best kind of explanation I can give to this guy, Eckhart Tolle. And so I hope that this has helped you be less confused and hopefully get you onto the right journey in Chinese medicine. I'd really encourage you to go and find a practitioner. Hopefully you can find someone nearby you. Now, I know there's people watching my channel that there are no good practitioners near them. I've had some people contact me from different countries where they literally legitimately have a difficulty finding a practitioner. And so I understand that, and I know that you still want the best for your health, and also you might live in a country where it's just extremely expensive and you just don't have the means to kind of look for the right, or you don't want to waste money. You'd happily spend the money if you could find the right practitioner. So I hope that this has helped you understand how Chinese medicine might be able to help you, particularly for this guy, but anyone else watching this that also may have similar kind of symptoms, or just want to understand the process of how a Chinese medicine practitioner works. So if this has been useful and helpful to you, please hit the subscribe button. We're on the way to reach 1,000 subscribers this year, and I want to help you on your own health journey. Maybe you've got a question about Chinese medicine. Maybe you'd want to know about how Chinese medicine can help in your situation. How would it view your body and your symptoms? Let me know in the comments below, and I hope you're having a great day, and thank you so much for watching.